Hello, and thank you everyone for joining us for this presentation for National Minority Health Month. I am Dr. Tiffany Crank. I have the privilege of serving as the Director of Health Equity and Community Impact as a part of the Office of Health Equity, working out in the Charlotte market and covering Charlotte and the Carolinas. I am honored to be here today with one of my esteemed colleagues, Dr. Renee Gonzalez. Renee.
Well, Dr. Crank, thank you for that wonderful introduction, and very excited to have a conversation around National Minority Health Month, talking to you a little bit more about what we do at the American Diabetes Association and how we address health equity.
Yes.
That being said, I'm your colleague in the state of Colorado, so I'm the Director of Health Equity and Community Impact, right? And I enjoy this role because we have opportunities to talk about health equity in this space. So, we've seen a lot of different definitions around health equity. What do you think it means to you, and why is it important?
Yeah. So I kind of have a very simple definition of health equity. To me, health equity is simply the fact for everyone to have the same opportunity to be as healthy as possible, regardless of any kind of circumstance. The way I like to position it when I talk to people is to ask a simple question. And I usually say, do you think that every child that is born deserves the opportunity to grow up and be as healthy as they can be? And, typically when people hear that, of course, the answer is a resounding yes. Every child that's born deserves to grow up and live a life as healthy as they can be. But unfortunately, there are systemic structures or these circumstances that really prevent this from happening in many communities. So essentially, a child could be born and grow up in a certain neighborhood, and they may automatically have a 10 or 15-year lower life expectancy than a child that is born or grows up, not even 10 miles away. And largely that's due to these inequitable circumstances. So the focus on health equity is really to eliminate those barriers and eliminate those things that contribute to this, these inequitable health outcomes between people.
Well, I really appreciate that wonderful definition, taking that perspective from a youth-centric approach to health equity. And I think that's a big reason of the why that you outline and how that impacts individuals and zip codes. And it's exciting because we're going to talk about that moving forward. So speaking of that piece, you did highlight, where a family or youth, where they start out, and that impacts their outcomes later in life. How do health inequities disproportionately affect certain communities that you mentioned earlier?
Yeah, no, that's a great question. I mean, certain communities are absolutely disproportionately affected. There are so many layers, really, that affect health equity. And these are things like poverty, having economic opportunities in communities, access to healthy foods, access to healthcare, having a safe place to be physically active, our public education system. These are all things that contribute to health equity. And the sad fact really is that minority communities and our communities of color oftentimes experience a heavy burden of the negative effects of many of these factors, which really leads to why our racial and ethnic minority groups have a disproportionate burden of preventable disease and of death and of disability. And so these communities are a huge focus of the work that we do in health equity, because again, these are all the things that affect somebody's ability to live life with their best health. So I could really go on and on and on on my health equity soapbox all day. But Dr. Gonzalez, I want to ask you a question. And my question to you is, we've been working as a part of this collaboration for equitable health for a while. So can you tell people that are listening, what is the collaboration for equitable health? What organizations are involved? Just kind of give us the scoop.
Yeah, thank you, Dr. Craig. We're talking about National Minority Health Month, and the key word here is national, right? So this collaboration is really a system-wide, nationwide initiative, which is powered, or thankfully through Bank of America, we have some wonderful funding dollars for a 4-year initiative within 11 cities or markets that we call it. I know we mentioned this early in our introductions, representing Charlotte, Dr. Crank, and I'm representing the Denver market here in Colorado. But it's really a system-wide, nationwide approach. So we are partnering with 3 other wonderful organizations that include the American Cancer Society, the American Heart Association, and even through the University of Michigan School of Public Health, who are helping us evaluate our work, right? And so with these wonderful partners, we are working to improve health outcomes with communities of color, specifically focusing on heart disease, cancer, stroke, and diabetes, right? And so I'm excited. But these cities, I'm guessing there's a lot of individuals asking, well, what cities are there, and why did we choose these cities? It's a very data-informed approach. I know we just mentioned our cities, but we have partners, colleagues within the American Diabetes Association with 3 other additional cities, which include Albuquerque, New Mexico, Atlanta, Georgia, and Washington, D.C., right? And so we took data-informed work. We talked about zip code level data, community-centric approach that focuses on these cities that have high diabetes prevalence rate, and so that's really the reason why we focused on these particular cities. But again, it's a nationwide, community-centric, system-wide approach, and I really like that piece because I get to learn about the work that my colleague Dr. Crank is working on, my other colleagues working on in different states and cities, and really understanding why we're focusing on certain communities. So that's why we're here today, Dr. Cranks. I love hearing about the work that you're doing when we're meeting off in different parts of the country, when we're learning about new markets.
Yeah. Thank you so much. That's a great synopsis of this exciting project. But tell us a little bit more. I would love for you to let everybody know about what the impact has been, what work has been done through the collaboration so far. And of course, I mean, impact is such an important part of telling the story of health equity work. So tell us a little more about that.
Yes. Great follow-up question, Dr. Crank. I think it's important that we are trying to provide programming efforts and training opportunities through what we call these pillars, right? We talk about Activate, where we engage with community, with the Project Power, which is a life modification approach for youth and adults. And it's wonderful because they get a lot of wonderful material that help them progress through their diabetes journey, or even promoting and providing awareness. We also have an access pillar, right, where we partner with community health organizations in this community healthcare promotora model is what we like to call it, and really provide a train-the-train model, very sustainable model moving forward. And lastly, another big important piece is our advocate pillar, where we work with communities and we form coalitions to create change at the city level, right, and try to make grassroots advocacy a big piece of our work. So a lot of the work that we're doing is around these pillars, but we've also invested in this initiative. We added 20 dedicated professionals to this initiative, and over the last few years, we've created over 90 partners, community partners. And what does that mean, this creation of partners? It's not just simply talking to a community-based organization, say, hey, do you want to work on a particular piece? We create memorandums of understanding. So we create documents where we sign together as partners that we're going to do this moving forward, that we commit to supporting the efforts of our community partners in this space. So over 90, I will say, moving into 2024, we have over 100 dedicated partners that have signed contracts and agreements with us to move this work forward. So they're really authentic partners in this space. And we also, the third piece is, as I mentioned, we are working with the University of Michigan. We are having qualitative interviews with our partners. We're wanting to make sure that the work is impactful and that we're achieving the outcomes that we're setting off to measure moving forward. for the next couple of years. So it's a lot of great
Yeah.
communication and collaboration in this space.
Yeah. I love that. I love that. The last thing before we get off of this topic is just in case people want to learn more about the collaboration for equitable health, or they want to know more, maybe get connected to join our efforts in National Minority Health Month and even beyond. Just leave some information for how people can plug in and tap into the collaboration for equitable health.
Absolutely. Probably one of the most simple websites is diabetes.org.
Mm-hmm.
Just log in there, type in collaborative, and our information will pop up. And you'll talk all about the information that we're doing, all the partners we have listed on our website. You also see our information about our health equity work that you spoke to at the beginning, Dr. Crank. But really reach out to, type in diabetes.org in the search box. You don't even, I think I typed in COLL and it already popped up with the first thing to search bar. So I checked it, I used it, and I wanted to make sure that I'm providing correct information to those listening to this work. But it's an exciting opportunity to learn more with this collaborative, and everything can be found at diabetes.org. So thank you for letting me put a plug in for our website in this space. But I also have questions for you, Dr. Crank. So
Okay.
I want to hear a little bit more about, I did talk about the collaborative. What other things can you tell us, or those who are listening or watching us, what are the exciting health equity initiatives is ADA working on?
Yeah, definitely. I mean, ADA right now, we're on fire. We are striving to be a leader in the health equity space. So in 2020 or in 2021, we were able to launch our Health Equity Now platform with some inaugural multi-year investments that were made by some amazing partners. Abbott, Baxter International Foundation, Bank of America, and Walmart, those were a part of that inaugural group. And since then, we have been working and building and expanding and growing our programming with these partners and with new partners in support of our ADA Health Equity mission. And that mission really is to build resilient communities by removing barriers, advancing evidence-based solutions, and advocating for change that supports access to health and wellness for all. So we have, I probably don't even have enough time left on the clock to really go into detail about all of our other projects, but all of our work is going on in support of that mission. And so I am excited. If folks do want to learn more, the website you provided is a great place to start. Reaching out to the health equity team here at the American Diabetes Association, we would be happy to connect and to plug into partners to see what can we collectively do to really advance our health equity mission, especially in our minority and our communities of color. So we have a lot here going on here at the ADA as we really try to trailblaze into the future.
That's great, Dr. Crank. It's always wonderful to hear all the systems connect, right? We're understanding that different organizations that you just mentioned and what we're doing with Bank of America and our other system partners, there's always some overlapping work, and it's amazing that we get to be part of that. So thank you again, Dr. Crank, for having this wonderful conversation with me on National Minority Health Month. And I'm excited to continue to work with you, obviously other colleagues in New Mexico, Washington, D.C., and Atlanta. So it's a wonderful opportunity. And thank you again for talking about the wonderful programs that we're offering here, Dr. Crank. So that being said, do you have any last comments or?
I do not. All I will say is, we launched our We Fight platform, and so any soldiers that are willing to join this fight, please. We can't say enough about collective impact and about partnership. So, would love to connect with anyone as we really fight the good fight to end diabetes. So thank you everyone for tuning in and for watching today. Thank you, Dr. Gonzalez, for sharing the space with me. And we hope to connect with you guys again soon.